tonight.
Pulse check.
Kerry and Tom battle to save a woman's life.
Ready, steady, move. You get a head and tube. Sit her up a little bit. Back plating, close out, back down. Back on the chest, perfect.
A man's attacked and stabbed several times.
We got one to the back of the head.
One into the back of the head, that's when most of the bleeding.
Yeah.
One to the left shoulder.
An 11-year-old boy's hit by a van.
Any pain as a touch?
I don't know.
You don't know. Good boy. You ought to be so brave, sweetheart.
And a woman's in agony after falling down the stairs.
I know, and that's why we need to get you off to the floor.
It's the start of the day in the West Midlands, and critical care paramedics Kerry Hemus and Tom Waters are getting ready for their shift.
So that's chest seal, that's done. This one's done.
The pandemic has placed extra demands on local services, and West Midlands Ambulance is experiencing a surge in 999 calls.
I've never, in my history, ever known it to be as busy as it is. 6,500 calls we're getting a day. It used to be 3, so it's more than doubled.
At times like this, the critical care team is more vital than ever.
So yeah, it could be anything today. Who knows? Who knows? There we go.
Well done.
Yeah.
Brilliant.
Ambulance service, is the patient breathing?
Sort of, yeah, she's just gone into some kind of fit.
She's fitting at the minute.
Yeah.
And how old is she?
64.
Does she complain of any chest or upper back pain before it started?
No, none at all.
Nothing. Okay, we have got help arranged as an emergency blue light ambulance. We're going to stay on the phone with you until we get there, okay? Has she been diagnosed with epilepsy?
No, never. She's starting to go cold.
Is she still shaking and jerking?
No, she's not.
Is she still breathing?
No.
Get her flat on the back for me and get by her side, okay? Place your hand one flat in the centre of her chest, the other one on top, lock your fingers together, keeping your arm straight, push down hard and fast. Don't be afraid to push too hard. You need to go at the rate of push, 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 push. Are you doing that, love?
I'm doing that, love.
Brilliant, just keep going for me. We're trying to get to as quickly as we can. I know it's tiring, but you just got to keep going for me, and I'll let you know when the crew are nearby, okay?
I have a nasty feeling that she's died.
Just keep going for me.
The symptoms described by the caller are consistent with a cardiac arrest. With a woman's life hanging in the balance, Tom and Kerry are immediately dispatched.
We're going to an address in Acox Green in Birmingham to reports of a 64-year-old female who has apparently had a seizure and then gone into cardiac arrest. It's quite common to go into cardiac arrest following a seizure. Sometimes the seizure is hypoxic in nature, which means they've been starved of oxygen. So cardiac arrest will sometimes follow a seizure for that reason. Sometimes these patients have got other underlying conditions, but until you get there, you don't really know.
When Tom and Kerry arrive, 2 ambulance crews are already in attendance.
I'm going to grab my PPE bag.
Okay. I'll bring everything else.
Okay.
Once in full COVID protective PPE, Kerry locates the patient in an upstairs flat.
I'm Kerry, hi. How are we doing?
64-year-old Indra had been sitting on the sofa with her partner Brian when she suddenly began fitting. He applied chest compressions until paramedics took over.
Are you right doing CPR for a bit?
Yeah.
So far, Indra's heart has not restarted.
Do you want me to go on the chest after you? Have a swap around?
Now Kerry and Tom can add their expertise to the mix.
Are you happy with the airway?
Airway perfectly fine. Just on the right from the eye gel. She has vomited in the airway, but that was a successful suction.
Lovely.
The paramedics are ventilating Indra with an eye gel airway device.
CO2 7.4. If you could just give a few vents, that'd be fab.
They're pumping oxygen into her lungs to buy them time until her breathing can be restored.
Adrenaline's going in. Pulse check. We've got some complexes. Anyone got any pulses?
No, it's still PEA.
And it's a PEA at quite a slow rate.
Good.
Then if you go back on the chest then, perfect.
Indra's heart is in a PEA rhythm, meaning electrical activity can be detected, but it's not beating.
Are we doing a BM?
In this situation, the heart can't be kick-started with electric shocks. Instead, the team must look for other solutions.
So reversible causes wise, she's been oxygenated. Thromboembolic, obviously there's not much we can do here about that at the moment. Trauma we can rule out.
The only other thing is if you could get a 500ml bag of fluid.
Fluid and adrenaline, please. Thank you. Do you want to take the Lucas?
I'll go grab it.
Yeah.
The Lucas device is used to mechanically apply powerful chest compressions.
What we want to do is we want to sit the lady up and get this back plate in. OK, ready, steady, move. You get a head and tube. Yep. Sit her up a little bit. Back plate in, close out, back down.
Nice.
Back on the chest, perfect. Lovely.
Well done.
Ambulance services, the patient breathe in.
Yeah, he needs an ambulance. He's been stabbed in the back of his head.
All right, so how old is the patient?
I know, he's 30.
30. OK, is he conscious and awake?
Yeah, he's awake.
OK, right, and has he lost enough blood to fill a mug full since he's been stabbed?
Yeah.
It's early evening in Birmingham, and reports have come in of a stabbing.
Let's go in Delta 98 on channel.
On shift, are critical care paramedics Stephen Mitch Mitchell and Dr. Alex James.
So we're going to an incident in Birmingham City Centre, or near the city centre, a patient who's been... we've got relatively little information at the moment, except that the crews at scenes asked for our attendance, and they're in relatively close proximity to the QE, which is a major trauma centre.
Hi, go ahead over. Yeah, Roger, literally getting a quick set of odds. You've got a gentleman. Injuries were caused by knife wounds, one to his shoulder, one to his neck area, which is the rear neck, and one to the spinal area, also one to the back of his head.
Paramedics have found the victim suffering from multiple wounds. It's exactly the kind of emergency the critical care team are trained to deal with.
So the potential things that we can add in this case would be delivery of blood products if they're required, and then some advanced surgical skills if those are needed as well. Good evening.
When Alex and Mitch arrive on scene, the patient's in an ambulance being treated by paramedics.
What's your name, mate? My name's Alex, one of the doctors.
The patient was at home when he got into a row with someone. The argument turned violent and he was stabbed with a knife.
So we've got wound to the back of the head.
One wound to the back of the head, that's when most of the bleeding.
Yeah.
One of the left shoulder.
Yeah, a little nick there. Yeah. One on that hand.
Have you been punched in the face as well?
Yeah.
Or is that not? Is that normal for you there? No. Okay.
The man has several knife wounds. The most serious are one inside his cheek, which is heavily swollen, and another which has punctured his upper back.
So, pulse rate 70.
Got a good radial, bit of active bleeding, not too bad. No surgical emphysema.
Although he's currently stable, it's vital to get the man to hospital as quickly as possible, in case he sustained any internal damage around his spine or lungs.
So whoever's driving, get ready in the front. Yeah, nice one.
So just go try and pop a drip in. A couple more cannula packs and some cannulas, green and a green if you've got one.
Before they can set off, Alex must insert a cannula so that drugs and fluids can be administered intravenously.
Go a bit higher, Mitch, you've got a good one here. Oh, let that hand go floppy for us. Perfect, lovely. I'll let that go nice and floppy on 3. 1, 2, 3. Put that hand there, we'll get that stuck down. And we've got the TXA there, haven't we?
Yeah.
With a chance that the man's condition could change at any moment, every second counts.
Right.
Blanket, we're good to go, mate.
Keep up with the fluids, definitely, at the moment.
In Birmingham, Tom and Kerry are treating 64-year-old Indra, who's had a cardiac arrest.
That's it, so attach that to there.
They're in the process of attaching a Lucas device, which can mechanically apply chest compressions.
OK, stop. If you could do pulse checks, please.
But before they go any further, It's time for another check for the patient's pulse.
Okay, I've got a pulse.
You have?
I've got a pulse.
So we've got a rate of 168.
I've got a pulse as well, 7 wrong.
Perfect, okay.
Following CPR and shots of adrenaline, Indra's heart has restarted.
We've got a blood pressure on there yet?
Not yet.
Rich, can you pop a blood pressure and some SATs probe on, if that's all right?
Tom and Kerry want to get Indra to hospital as soon as they can.
It's a pretty rapid rate, isn't it? It's a narrow complex ECG.
Only now, her heart is beating too fast.
That probably coincides with that adrenaline scale, I'd imagine. What's the SATs?
It says 61 on there.
OK, so that's not great, is it?
And the oxygen levels in her blood are too low.
I reckon we could probably pop a tube in.
Pop a tube in.
Yeah, what do you think?
Yeah.
Tom updates Indra's partner, Brian.
Currently, her heart's beating again at the moment, but she's obviously really, really sick at the moment.
Yeah.
So we're just going to do a bit more. We're not going straight away because we want to optimise her before we move her.
You want to make
stabilise. Exactly, because it's going to be quite challenging to get her down the stairs. So we just want to make sure that she's in the best possible way before we move her, and that's what we're doing. OK, just in case you had any questions.
No, I'm just reading routine.
OK.
Get on with it. You know more about it than I do.
OK, well, thank you.
Tom and Kerry are concerned that moving Indra too soon could cause her to go back into cardiac arrest.
So what we're going to do, because I know it's really hard for everyone to hear, Kerry's going to pop a tube in. So the reasons are, we're going to have to move her downstairs. She's got low saturation, so we want to pre-oxygenate as much as we can. So that's kind of...
That might settle her heart rate a bit, hadn't it?
Yeah.
Okay.
And then...
Tom and Kerry decide to swap the eye gel with a tube placed directly in Indra's windpipe to optimise the ventilation.
OK, so what we do know is we can ventilate with an eye gel, so we're more than happy to take it out. If we can't intubate, we'll just stick the eye gel back on.
Straight back in with the eye gel. OK, yeah. If I can have the bougie, tell me.
Bougie's there for you.
Suction's just on your left if needed.
Feels good?
Yeah, that's gone in.
Perfect, OK, so cuffs up.
Pop that back on.
I've got this for you.
Lovely.
I'm just going to give her some good oxygenation.
Yeah, that's great. Lovely. Let's get this out of the way. So we've got misting on the tube, good rise and fall of the chest.
Gradually, Indra's vital signs improve.
So we've got SATs of 83. I've just snapshot that.
Her oxygen levels are up.
And have you just got a pulse on her at the moment? Just have a quick feel. 91, brilliant.
And her heart rate has steadied.
That rate's come down nicely now she's been oxygenated.
I think this is a good time to go.
Yeah.
The team can now prepare for extrication, getting Indra out of the building and into an ambulance.
Right, once she's had that bag of fluids, which I think she's already had, we will roll the lady onto her left side, put the sheet under, and then try and drag it through as best we can, all right?
As there's a narrow staircase, Tom and Kerry have opted to use a carry sheet rather than a scoop stretcher.
Ready, steady, roll. That's it. Slide it all the way down, and then we'll just need a blanket as well to cover her over.
Although a carry sheet is more manoeuvrable, it can make for a bumpier ride.
Now, whilst we are in a rush, we are also just taking it nice and steady if everyone's happy.
The team must be as careful as they can.
Right, well, the Lucas is on, and that's a good thing, because it means that if we lose a pulse, that we can push a button and she'll get CPR straight away, and it'll save us having to delay. Ready? Yeah. Steady, lift.
Well done, guys.
Oh, we're trying to squeeze through yet.
Keep them going straight down, watch your elbow. I'm going to take your radio, because you're going to catch it.
If anyone sees anything as we're moving, just shout out.
Well done.
Yeah, head's clear. Right, that's it. If you're all right to lift to the bottom end, let's just go really gently down, because I'm just kind of squeezed in here, yeah? Well done, everyone. That's it. Slide out.
Wait.
Although time is critical, Tom spares a moment for partner Brian.
She's asleep, but she might be able to hear you. If you just want to give her a quick kiss.
Don't worry, they're looking after you.
Will do. OK.
That's it.
Right.
Indra has made it into the ambulance without further incident.
Right. So, what's the ETA to the hospital from here?
We're at Spark Hill. We're looking at about 7 to 8 minutes.
To Heartland. OK.
Now Kerry and Tom must keep her stable until she reaches hospital.
So if we stay as we are in terms of like the ventilator, as long as we keep an eye on the oxygen, then we can just go in like this and we haven't got a faff because we are so close. The only other thing to do is maybe just give her a bit more fluid on the way. Oh, have you got another 50 ml or not? Yeah. Oh, lovely. Let's get some more fluids in her. She's got a good pulse, hasn't she?
She has a nice
yeah. Just mind that fluid bag, but take it over my head. Lovely. It was worth doing, wasn't it? Just staying in the room for a little while and just stabilising her.
It's now more than an hour since the 999 call.
Right, let's keep her covered up. Nice and steady then.
Less than 10% of out-of-hospital cardiac arrests result in survival. Kerry and Tom are hoping the tremendous team effort will be enough to help Indra beat the odds.
On our arrival, there was nothing to indicate what may have caused the cardiac arrest, really. And after a couple of adrenaline and some fluids, she did get a pulse back. She got a blood pressure, which is a good thing. And then she remained stable en route. So there's always that little hope of her actually walking out of hospital.
The police.
Mummy's upstairs.
Is your mummy okay?
No.
Is your mummy hurt?
No.
And how old are you?
3.
I'm going to get you some help.
Ambulance service, how can I help? Hi, it's the police. There's a toddler on the line to us saying that Mum is not waking up. Are you able to tell whether she's breathing or not? They don't know. Just said Mummy fell off the stairs, she's poorly and not waking up. We're on the line to the child still. Thomas, aged 3. Okay, we have got something on the way already. Are you guys attending, are you? We are, yes. We're en route. We're probably going to be fourth entry. Yeah.
32-year-old kid's calling for mum. Unconscious on the kitchen floor. Recently discharged from hospital from asthma. They need to have about 6 minutes.
It's a Friday afternoon, and critical care paramedics Ryan Ferris and Kerry Ben-Ashman are responding to the call for help.
So we've just been assigned to reports of a 32-year-old female who's unconscious and query breathing. Sounds like the caller is actually potentially this lady's child.
What's caused the woman to lose consciousness isn't yet known, and there could be a threat to life.
Due to the nature of the job, they've assigned 2 ambulance crews, one of which I believe is currently following us to the job, so there is a chance we may be first on scene.
Ryan and Kerry reach the address in just a few minutes. To find the police are already at the scene.
Hiya. Is that the child? Where's Mum?
Mum's in the child fight.
Thank you.
Inside the house, an ambulance crew is tending to the patient.
Hello. I think she might have fallen down the stairs. She doesn't remember. Okay. All right.
No worries.
32-year-old single mum Kayleigh woke up at the bottom of the stairs with no recollection of what happened. She's since been unable to get up.
So keep on the gas and air.
Where's it hurt in the mouth?
This hip.
In your hip?
A little bit in my back here.
Okay.
And my shoulder and my tummy.
Paramedics are giving Kayleigh Entonox, commonly known as gas and air, to try to bring her pain under control.
How would you score your pain out of 10 at the minute?
10.
10.
Sounds like she's came down a number of stairs and then just woke up at the bottom.
Okay.
So imagine she slid down on her back more than anything.
Okay.
Injury-wise, she doesn't appear to have anything obvious. I don't think there's going to be any need to immobilise her. She's GCS 15, she's moving all limbs independently. Perfect. So I'll let the girls do their assessment, then I imagine it'll be a case of walking out to the truck.
Although there's nothing obvious, Kayleigh could still have sustained a serious injury in the fall and will need to go to hospital for a full assessment.
Is the little boy okay? Yeah.
While Ryan assists the ambulance crew, Kerry checks up on Kayleigh's 3-year-old son Thomas, who made the 999 call.
Hello. What are you doing? You're lying down? So did he see Mum fall, or did he just...
No, he said Mum wasn't moving, and then he's rung us. I think she was unconscious, and then during the call, she's come down. But he's managed to ring us to let us in and everything.
Oh, bless his cottons. Are you a clever boy? You need to sit quietly. So what do you guys want? Do you want to see if we can get a relative or...?
Drop him off, so maybe she's happy. She can give us an address.
OK.
Off the Nans.
Her little boy has done amazingly well and sort of rang Treble 9. So he's currently putting all the lights on the police car and he's doing really well. Let them in as well. That's pretty cool, isn't it?
Yeah.
Can you move this leg at all, sweet?
But while Thomas is unfazed by the morning's events, not so his mum.
I'm feeling a bit loopy and the pain's not disappearing.
All right, that'll be the gas and air as well, though.
I'm trying to get up on my own because you guys are under enough pressure.
No, it's all right. We don't know how far you've fallen down the stairs, is the issue.
I'll grab the kit.
Oh, it hurts.
It's not yet clear what injuries Kayleigh has, and the Entonox is doing little to ease her pain.
She'll just get a scoop and stretch her. I'll go and grab a scoop. I think that's the only way we're going to get her out.
Kerry and Ryan need to find a way to get Kayleigh safely into the ambulance.
You're just going to unattach the top of this scoop stretcher, then scissor it upwards. And then we're going to pillow or something for behind the lady's head, and then we can look at this hip once she's flat, can't we?
I'm good with that.
I need my charger and my phone.
Kayleigh, your phone, your charger, your handbag, forget about all that for now, okay? We need to get you sorted. What we're going to do in a minute is to lie you flat and get a board underneath you, okay? That way we can get you out into it. I know, and that's why we need to get you off the floor. All right, sweetheart.
In Birmingham, Dr. Alex is treating a man who's been stabbed several times.
Lovely. You've got the TXA going?
Yeah, I'm just about to.
Smash in, I'll do the paracetamol some analgesia. 9-8, thank you. We're leaving scene with an ETA to the QE of approximately 10 minutes over.
With a deep puncture wound in his upper back, the man could have sustained serious internal damage. And Alex wants to get him to hospital as quickly as possible, in case his condition suddenly deteriorates.
We're going to go to the QE because they look after people that have had injuries like this, and they're a bit of a specialist centre as opposed to your nearest hospital. It's going to take about 10 minutes to get there. Say again? Yep, we're getting that sorted now.
Wounds can be agonising, and Alex will need to give analgesic drugs to bring the pain under control.
Have you had any paracetamol today already? Smashing.
We don't have any significant medical history.
Any allergies at all?
Alex has inserted a cannula in the man's arm, so medicines can be administered intravenously.
Just lift that arm for me for just a second. I'm just going to wrap this round because I don't want it to come out.
Introducing the drug straight into the bloodstream means they act faster.
Thank you very much. We're going to start with a bit of this. Intravenous paracetamol because it's quick and easy, and then we'll get some morphine going as well. And we'll give him some tranexamic acid, which helps the blood clot and sort of reduces the chance of ongoing bleeding. Paracetamol's in. Thank you, thank you. Yeah, 10 milligrams, 523, smashing. Okay, a bit of morphine going in now. Okay. So that's going to start taking effect. It does take a bit of time to get going, but we'll get there, all right? Going to put the blood pressure cuff back on now.
Blood pressure is 138. Perfect.
So yeah, it's got a good radial pulse, nice tap trace, not tachycardic, veins are nice and well filled.
The man's vital signs are reassuring and suggests he's not bleeding internally.
I'm just going to take the oxygen off for just a second.
Alex seizes the opportunity to take a closer look at the wound to his face.
Open your mouth wide as you can for us, that's smashing, well done. Quick look down here. Super. Good stuff.
The wound is heavily swollen and will need further investigation.
So we're pretty much there now. Okay, we'll be out the back of the doors into A&E. There'll be quite a lot of people who want to know what's gone on. So there'll be quite a few people for us to have a chat to. It's probably going to be a CT scan just to make sure that there's nothing untoward with the one in your back.
Birmingham's Queen Elizabeth Hospital is a major trauma centre.
Right, we're pretty much pulling up.
Here, the man will be met by a highly experienced team of specialists who treat on average between 3 and 4 victims every week.
Yeah, I think we can go in without the oxygen, can't we? Okay. Yeah, good for you up. Right now, all looks good for me. Bit of a bump down there. Smashing. He sustained multiple puncture wounds. So the one that was probably of most concern was the wound on the back of his chest above his shoulder blade. And I think that was probably the site of most of the blood loss. I suspect that the wound to his face may well need an operation to explore it further, wash it out and deal with the swelling to his face. He's definitely going to need a CT scan of his neck and probably of his head and face as well. Stabbings and assaults are a really common use of our time. I think probably up there with road traffic collisions as the most common source of our activations. In Birmingham on a Saturday evening, you would predict that you're going to be busy with this kind of work.
And some surgical gloves.
Surgical gloves, just in case.
On the outskirts of the city, another pair of critical care paramedics are preparing for their shift.
It's going to rain all day today, which is quite nice.
I think I'll stay in the car.
In the car?
Yeah,
No,
and
no,
you
no,
can
no.
get out and deal with it.
Faye Pollock and Alistair McNeil have a combined experience of more than 35 years.
I think the beauty of this job is that it's so very unpredictable. Today we might have the quietest of days. I don't think there'll be a day where we don't do any jobs.
No!
I'm sorry! But at the same time, we might have the most horrifically of busy days. But that's the beauty of the job though, isn't it? It's just that you don't know. I like it to be a bit spontaneous. We are done.
Ambulance says, is the patient breathing and conscious?
Yeah, but he's been hit by a bus.
He's been hit by a bus?
So basically, the kid was crossing and then he got hit. Did he get hit by a bus or a car? A van. I think he's in year 8 or year 7.
Is he injured? Does he look injured at all?
He's bleeding, but I don't know if anything's broken. I don't know. He's laying down, so...
Is he on the floor, yeah?
Yeah, he's just laying down on the floor, yeah.
Okay, I have got the help arranged, okay? We will be there as quickly as we can.
A road traffic collision involving a child is treated with the utmost urgency. Faye and Alistair are immediately dispatched.
We've just been responding to a pedestrian that's been struck by a van. Patient's been hit by a van whilst crossing the road and is bleeding from the face, so we're not quite sure yet whether it's Cat 2. So we believe that patient is breathing and is conscious.
Sorry, afternoon. So just an update on this case. We believe that a van has overtaken a bus that's pulled over and the child that's been crossing has been hit by this van. Riding the road with a head and face injury. And it looks like you'll probably get there at the same time as the crew.
That's all received. Many thanks.
The accident's taken place on a busy A road during the school run.
So we are first on scene. Let's stop there.
I'm just going to go straight to him if you're cool with that.
I'll get your bag.
Thank you.
11-year-old Oscar was walking home from school when he stepped out in front of the bus and was hit by a van. He has a visible wound on his face and is distressed.
Are you upset just because of what's happened or because you're in pain?
I don't know.
You don't know. Okay.
While Faye tries to work out how badly Oscar's been hurt, his mum, who was called by the school, anxiously looks on.
And I'm going to have a little feel of your chest. I'm sorry if my hands are cold. I'm sorry if I'm a bit tickly.
Movement or pain in the chest could indicate broken ribs.
Okay, any pain as I touch?
No.
No. And we're going to have a little feel of your tummy.
While a rigid and tender abdomen could be a sign of internal bleeding.
Any pain as I touch your tummy?
No.
No? Good boy. You are being so brave, sweetheart. I know you're cold. We're going to get you off this floor in a second. Can you lift your left leg? Good boy. Can you lift your right leg? Super.
Oscar's legs also appear to be unharmed.
What I'm going to do is I'm just going to take your coat off first, all right? Just so that I can see your hands. Good boy. Oh, do you want to sit up? Oh, okay. Okay, Mum, I think he's happy to sit up. I'm going to have a little look at your back by doing that. Hold on to Mum. Mum, how's his health normally? Is he normally well? Yeah, doesn't take any tablets at all. No. Okay, we'll wrap you in a little blanket, all right? We'll cuddle you up.
So, Oscar, just move the feet as well for me. Wiggle toes and move feet. OK, those are fine, aren't they?
Skin colour-wise, you know him better than anybody. Is it normal skin colour or is it a bit pale or...? Yeah, OK.
So far, it seems the injuries are confined to Oscar's face.
From what this chap's saying is it was the wing mirror that hit him, like, in the face.
In the face, yeah. It's the whole brute force.
Yeah, so this is the wing mirror on the floor here by the bin, all right? Yes, and the van further down has only got damage on the wing mirror, all right? There's a little bit of blood on the driver's window, which has come from your nose, and there's no other damage on the car, so I can't see any other thing that would give us concern.
Oscar has taken the full force of the van's wing mirror.
Let me have a look at your mouth. Have your mouth wide open. Good boy. With your tongue, can you feel as if you've got any loose teeth?
Yeah, Mum.
Oh, yeah, I can see your loose stuff. All right, okay.
Oscar has a laceration on his lip, a bloody nose and a wobbly tooth. Though Faye and Alistair haven't found any signs of further injuries, they're not ruling them out just yet.
Hello.
An ambulance crew has now arrived to assist.
This is Oscar. He's 11 years old. He's been hit by a van, query speed. He wasn't knocked out, GCS 15 throughout. This is Mum Emma. I'm thinking, let's get him into the truck if you don't mind. Warm him up, just try and calm him down a little bit because everyone's staring at him and we'll go from there.
Slow, deep breaths for me, OK?
In Rowley Regis, Ryan and Kerry are treating single mum Kayleigh, whose 3-year-old son called 999 when she fell down the stairs.
Oh, my hip, Mum. Is it the hip or the knee that's more painful? And the knee. The hip and the knee.
Kayleigh is suffering intense pain in her back, hip and knee and can't get up. Ryan is hoping that continuous inhalation of gas and air will ease the pain enough for her to move.
It's not going to take the pain away. It's still going to be sore, but we need to get you off the floor. All right, sweetheart.
I feel sick. But obviously, like we've said, it wears off quick, so you need to stay on it for it to work. What we're planning to do is get you on the scoop and get you out.
Kayleigh, we're going to need to shuffle you forward slightly, okay? Now that's going to be painful, but otherwise we can get you out, okay? So I'm going to support this leg a little bit, and with Naomi behind you, we're going to support you forward, okay?
I don't want to, it hurts.
Kayleigh, you just need to work with us, my love, and just help us a little bit, okay?
Keep taking the gas, Kayleigh.
Suck it in, sweetie, suck the gas.
Just for a few minutes.
Kayleigh, keep breathing for me, but listen to me, okay?
Where's my phone?
So your son's outside at the minute, he's playing in the police car, he's having a much better day than all of us right now, okay?
I don't want to, I'm scared.
I know you are, but I promise we're not going to let anything happen, okay? But if we can't bring you forward, then we can't get you out of the property. And once we get you onto this board, you're going to be in a much more comfortable position, okay? I'm going to support this leg. Naomi's behind you. We need you to try and shuffle a little bit, okay? Ready? 1, 2.
Sorry. Ow, my bum! Ow, my bum!
Press down on the floor for me. When we're bringing you forward, lift your bum off the floor, okay? On 3 again.
We don't need that. Okay.
1, 2, 3. Well done.
Oh, I can't!
One more, Kayleigh. One more.
I can do this.
That's it.
There we go.
That's it, you're done.
Well done. Well done. That's it, it's done. Well done.
Well done.
All done.
Let's get you out. There's a blanket there.
Oh, no. Why is it really hurting?
Well, until you've had some x-rays and stuff like that, we can't tell.
There's no sort of
There's no shortening.
No. And she actively flexed herself once we were.
I think it's maybe just a muscle spasm.
The pain in Kayleigh's hip may be a muscle spasm caused by being on the floor for some time, but it could be something more serious and needs to be checked out.
So the little boy's gone to your nan's, Kayleigh. Your son's gone to your nan's. He's absolutely fine and having a lovely afternoon. He's doing the lights, he's doing the sirens.
Oh my goodness. He's grounded for my picture.
I wouldn't ground him, I'd reward him. The fact that he just called an ambulance at 4, that's amazing.
Kayleigh will be taken to hospital, where she'll be given scans and x-rays to find out whether she has any injuries requiring further treatment.
Kayleigh, all the best, okay? Give your son a big well done, he done fantastic.
As her condition is not critical, Ryan and Kerry do not need to travel in the ambulance.
So I think the biggest thing from that job is the fact that her son has managed to call the ambulance, and it's just fantastic. I think that kid deserves a bit of an accommodation from mum, and probably ice cream for
several weeks.
Several weeks at least. Breakfast, lunch and dinner. So I think if we take anything from this job, a bit of a public education about sort of having a chat with your children, what to do if that horrible emergency ever does happen.
You are being the bravest boy.
In Birmingham, Faye and Alistair are treating 11-year-old Oscar, who was crossing the road when he was struck by the wing mirror of a passing van.
You're just totally taken aback by what's happened. You are a good boy. As you are as well. You are allowed to have a good cry, but just not yet. When your husband arrives, then you can have a good cry, right?
Oscar has cuts to his face and a loose tooth.
Would you mind awfully if we just get the stretcher out?
But Faye and Alistair want to be sure he has no other hidden injuries.
Do you think, with the help of these 2 ambulance men, that we can see if we can stand you up? And we can go and get you in a nice little ambulance, and we can have a good chat to them? Yeah? OK, listen, really important now. Stretcher's here. Swing your legs around gently, because what I want to see is to see whether you've got any other injuries. That's it, all the way to over the curve, nice and gently. Hold on to my hands and let's see if we can stand you up, OK? Right, stay there a second. Squeeze my hands, lift your left leg. Is it sore? No? Lift your right leg. Good boy. OK, what we're going to do is we just need to sit your bottom in that crease there. Good lad.
Although still clearly distressed from his experience, reassuringly, Oscar is able to stand more or less unaided.
Swing your legs round, sweetheart. There we are. That's better already, isn't it? Off the floor.
After becoming cold lying on the ground, a layer of blankets will help to warm him up.
Boy, you look like a little Christmas turkey now. Oh, this looks like Dad. Oscar, who's this? Who's this? Dad, we're just going to get him into the ambulance. We rest assured there's nothing mega at the moment. We're just going to warm him up, give him some pain relief and see how he is. All right.
Only in the comfort and privacy of an ambulance will Faye and Alistair be able to assess Oscar fully.
That's better. Come on in, Mum. Oscar, let's take your jumper off, OK? Skin a rabbit. That's it. Do excuse me, I'm just going to have a little look and a little feel of your chest again. Good boy. Any pain? You're not sure? OK. Any pain as I touch your shoulders?
No.
No, OK. Any pain as I feel your tummy?
No.
Besides the cuts and bruises, no further injuries are found.
So, Mum, you assure us he's not allergic to paracetamol? He normally has Calpol.
A dose of Calpol, a paracetamol solution, will take the edge off any pain.
OK, this is Calpol that Mummy normally gives you, OK? So it's going to help you with the pain. I can do it for you if you want to. Put it in your mouth, or you can do it.
You want me to do it?
Mummy do it. Mummy do it. OK, just sip it, and let's see how well you are at swallowing. That's it. Does that hurt to swallow? No? Good. Good boy. Could you just have a little bit of gauze and a bit of water, and we'll just clean up that wound.
Before he goes to hospital, Faye wants to take a closer look at the cuts on Oscar's face.
Right, let's just clean you up very gently, just to make sure there's no other wounds to your lips. I know, I'm sorry if it's a bit sore and it tastes a bit funny. I'm sorry. Be brave, be brave, be brave. Bit longer, bit longer. Oh, yes. Oh, yes. Good lad. Oscar, you are the bravest. So, Mum, I think he's got one little one that probably doesn't need much, don't need to do much about that one. That one probably needs a stitch.
And at this age, a stitch or two there actually is probably not going to scar much. Yeah, you'll grow out of it.
So, and I think as much as the city hospital is just down the road, I think probably whilst we're 10 minutes further to go to the children's, as is a child, let's take him to the children's. Oscar, if you feel as if you want to have a little nap now, you sleep away. Mummy's not going to go anywhere, she's going to go with you. Let's seatbelt you in.
Oscar will be taken to Birmingham Children's Hospital, where his injuries can be further treated.
Goodbye, take care.
As his condition's not critical, Faye and Alistair leave him in the care of the ambulance crew.
He's going to go to the Children's Hospital for a quick checkup, and then I absolutely put my month's wages on the fact that he'll be at home in a couple of hours with some painkillers, very sore, in the arms of his family at home. So, but he's a very lucky little boy in that could have gone really quite pear-shaped.
It's a really slow recovery. I have my good days and my bad days where I can't walk and my shoulder's really hurting, but hopefully on the mend. 999! I didn't believe at first what Thomas did. It wasn't until I actually heard the recording and how calm he was on the phone. He wasn't scared at all, and that's just amazing. I'm just so proud of him, words can't describe.